Mexico is considered to be one of the most obese countries in the world, yet analysts say this is a relatively new problem, beginning with the aggressive introduction of processed foods to the diet when the country adopted neoliberal trade policies since the 1980s. Clayton Conn now reports on the negative health impacts within the population.
Every week, the customers line up for freshly prepared quesadillas or tlacoyos, traditional Mexico City street food that is nutritionally rich. However, some say it is not always the first option to quell the stomach's hunger.
La gente pues prefiere lo más fácil y lo más fácil es la comida.
People prefer the easiest option, which is junk food. But if you come to a street market, you will find what you cannot inside a supermarket.
Mercados de autoservicio.
Vendors of fresh and non-processed products in the city's iconic street markets known as tianguis affirm that the preference for the supermarket is growing. In fact, supermarket sales have gone up by 5% this year alone.
Supermarkets have dropped our sales for their lower prices, but the bad part is that they have bad produce, refrigerated.
27-year-old Fernando Trejo was one who preferred the supermarket over the produce of the street market, yet he says this contributed to his diagnosis of diabetes, which has been anything but easy to live with.
It's complicated to know that you have to live with this for the rest of your life. And while it is difficult at this age because you like sweet things, and in parties where you want to drink, you cannot because everything is restricted.
According to official statistics, diabetes and related conditions such as obesity lead to more than 170,000 deaths a year, a number that experts say has dramatically increased since Mexico adopted neoliberal policies 20 years ago that displaced locally produced products for imports of cheaper processed foods.
In recent years, because of these changes, it has been studied that the consumption of sugar, especially sugary drinks, liquid sugars, have impacted health greatly.
The monetary impact amounts to more than $4.2 billion a year in the public health system, while experts say the poorest sectors of society are the most directly affected and targeted.
The population of less resources is the most affected because the food industry has strategies in which it introduces these foods to the most marginalized communities.
Consumer rights advocates are pushing for public policies that increase taxes on processed high sugar and fat foods, while at the same time pressuring for greater support of small-scale local producers. Clayton Conn, teleSUR, Mexico City.